Many have turned to other ways to keep the virus at bay over the winter months. Vitamin D supplementation had been seen as a possible treatment, but now a landmark study has said there simply isn't enough evidence. A small number of studies have indicated that vitamin D could help the immune system fight off Covid-19. However, this latest research conducted by the National Institute for Health and Care Excellence says there's insufficient evidence to back up those claims. The study says that more trials are needed before a further conclusion can be reached. When experts had hoped a review could back up earlier indications about the vitamin, more than 80% of hospital patients with Covid-19 were found to be lacking it, while minority groups are also frequently vitamin D deficient and have been hard hit by the virus. But despite the latest findings, experts are still saying supplementation for high-risk individuals is to be encouraged. Well, to discuss the vitamin D report and the latest developments concerning the tiers, I'm joined by expert in communicable diseases, Dr. Bharat Pankania. Bharat, thank you for being with us. Let's start with the tiers then. The government reacting to the rising cases across the southeast. The right call, do you think?
Oh, they've got no choice. So case numbers are going up, and this is not a laughing matter. I heard in your report a few minutes ago, Matt Hancock, Secretary of State for Health and Social Care, saying it is up to individuals to take personal responsibility. I would say fair enough, but it is also up to our leaders to take responsibility and say it as it is. Getting together over the Christmas period is a risky business. And if we are in Tier 3 today, and then in 6 days' time, all bets are off and we can do as we wish, is not good infection control measures.
Is, in effect, the government passing the buck here, saying people can make their own minds up on how they behave over Christmas?
I think it is laying the grounds for a failure. What I'm trying to get at is when in middle of January we have a surge in number of cases, our leaders will come to the podium and say, yes, but we told you to be careful and it's your fault that you've now got infected. I would say it is a two-way partnership. The leaders stand up and say it as it is. Take Christmas seriously. Do not interact, do not mingle, do not get together in large groups. You got to say it. And then people can also make their own decisions. That's a good partnership, I feel.
Will people make the right decisions, though? Many people have made their Christmas plans already.
I think this is, again, the failure, because we should have been upfront and upright a month ago saying getting together over Christmas with families and friends is a risky business. And now, of course, with only a few days away to Christmas, it's difficult to do a U-turn. But I would still say, if you can, for your own personal health and well-being, consider it a low-key Christmas, because I want you around in 2021, alive, well, and in good health.
Hard, though, for the government to make one rule for all, isn't it, really? When we look at places like Bristol and North Somerset, they're now moving down a tier. And then we see Manchester's rate is dropping, but still no movement for them.
Yes, indeed. And it just, again, exemplifies that this tier system is almost a random chance event where you go from 2 to 3 and 3 to 2 and so on. What is really required is a concerted effort to have restrictions. And I would say use the advantage of the Christmas shutdown to be bold and brave and do it, which is extend the shutdown period over Christmas. Therefore, you get the natural break of Christmas as well as a government-sponsored additional break. And that may bring down better news for the nation, which is lower case numbers in January.
And of course, other European countries are tightening their rules over Christmas, aren't they?
Yes. Yes, indeed. And, an example from Germany, Holland is exactly that, whereby the leaders there have said, sorry, 2020 Christmas cannot happen like it has happened. We're going to have restrictions because we want you to remain well. And not only that, but the vaccines have arrived, and therefore we will see better times in 2021.
Can we talk about the report on vitamin D and its effectiveness? The latest report is inconclusive. Would you back supplementation?
I would back supplementation, but we need to sort of be very clear. Supplementation, good for you. Supplementation to avoid or cure SARS-CoV-2, COVID disease, we don't know. So my advice would be, yes, we live in the northern hemispheres, not enough sunlight in the winter months, and difficult to get vitamin D from the sun or the diet. Therefore, please take it. By all means, take it. I just want that distinction that at this point in time, we don't know if vitamin D also helps combat SARS-CoV-2, COVID-19 disease.
Yeah, so it certainly doesn't do you any harm then to take vitamin D over the winter months?
Not at all. In fact, I would recommend it. I would say do it and do it forever. So I have a lot of friends like myself who are dark-skinned, and 6 months of the year we're in darkness or reduced light. So I say, actually make it a habit to just take it and take it forever.
Bharat, really good to talk to you. Thank you so much for joining us live here on RTK. Dr. Bharat Pankania.
Thank you.